In earlier centuries, diseases that are not contagious, such as heart disease, strokes, diabetes, cancer, and hypertension, were mainly found among wealthy social classes living a luxurious lifestyle. The vast majority of people at that time lived in rural areas, often in poverty, and in Europe until the late 19th century, infectious diseases and injuries were the main health issues. Health policymakers in 19th century Europe believed that effective public health initiatives would reduce the heavy burden of infectious diseases. The Industrial Revolution improved living standards, led to the creation of vaccines and antibiotics, and ultimately resulted in organized public health systems funded by the government. After global immunization and clean water initiatives were introduced in poorer nations in the late 20th century, deaths from communicable diseases dropped quickly, similar to the earlier decline in wealthier countries. Acute bacterial infections, which were common in the past, could typically be treated successfully within a few weeks. At the same time, evidence was building in many industrialized countries showing a rise in non-communicable diseases. The success of evidence-based medicine helped manage many of these previously incurable diseases, turning them into lifelong conditions. As seen with diabetes and severe kidney failure. Consequently, chronic diseases imposed a long-term burden on both patients and society. Nevertheless, the approach designed for infectious diseases is ineffective when applied to non-communicable diseases. These diseases do not arise from unintentional contact with biological agents, rather, they primarily result from voluntary engagement with known harmful products and lifestyles. Such detrimental habits are readily adopted yet challenging to abandon, as they represent evolutionarily recent advantages of modern life and increasing wealth. Today, chronic diseases are continuously changing with the touch of many emerging risk factors which we are acquiring from our day-to-day lifestyles. Researches are ongoing to capture those factors to halt the speed of this health transition.